Hi guys, I'm Dr. Anne and this is the Health Hub. So today I'll be telling you top 5 reasons why you shouldn't be doing it during pregnancy, or conditions that might require you to abstain. So hurting the baby's head is not one of them, and that is a myth. So basically I'll be giving you a list of 5 conditions in pregnancy that require one to not engage in sexual intercourse. So basically with these conditions, one is advised to have pelvic rest, because in such conditions sexual intercourse can cause harm not only to the mom but to the baby as well. So pelvic rest is a term that is used in obstetrics to indicate that one should not engage in sexual intercourse or penetrative sex during pregnancy. And there are several reasons for this, so I'll just be listing a couple. Let me just tell you about the theoretical mechanisms in which sexual intercourse can induce labor. So first and foremost, cervical stimulation results in release of prostaglandins by the cervix, and then this then results in cervical dilation and therefore labor. Number 2 is that semen contains prostaglandins or natural prostaglandins, and these can result in induction of labor and therefore cervical dilation. Also, nipple as well as genital excitation or stimulation can result in release of oxytocin, and oxytocin is basically a hormone that results in basically the start of labor or induction of labor. So without further ado, let's start with reason number 1 why you should not be having sexual intercourse during pregnancy, and that is cervical incompetence. So cervical incompetence is a condition where one has shortening of the cervix. This can happen because naturally, because they're just born with a short cervix, or it can be as a result of if a person was found to have an abnormal pap smear and has had colposcopy or LEDs before. This then results in shortening of the cervix because a part of the cervix is cut off during those procedures. If it's shorter than 2.5 centimeters, you are then required to have a cerclage inserted and it's inserted around 13-14 weeks of pregnancy to prevent you from basically going into labor. So the stitch is inserted, and then around 36 weeks is then removed so that you can go into labor, because at that point your baby is big enough and is strong enough to survive outside the womb. You don't want to mess around with like a short cervix. Just leave it. Like, have a stitch inserted if you're found to have this condition, and then just abstain from sexual intercourse until after pregnancy. So the second condition in which one is told to abstain from sexual intercourse during pregnancy is, so pre-prom or prom is preterm pre-labor rupture of membranes. Anything that happens that results in your membranes rupturing before time results in not only danger to the mom but also the baby, because amniotic fluid and the whole sac acts as a sterile conduit for the baby to grow. Because of the cervix and the whole sac, nothing from outside can enter and cause harm to the baby. So basically, at least if it's anything after 34 weeks, one can be, the labor can be induced basically, because if you keep the baby longer, you pose a risk of infection. But anything that is less or preterm, you try to keep the baby in for as long as you can. And with these women, sometimes they're told to stay in hospital for the time being so that they can be monitored, given IV antibiotics, and basically checked for a complication that's very fatal and severe. And that complication is chorioamnionitis. And this is caused by introduction of germs, bacteria from the outside that reaches the mom and the baby as well. So in this case, women who are allowed to go home are told to not have sexual intercourse, or not to take long baths or sit in a bathtub, but to have showers to try to prevent them from getting infected or having the baby infected, and therefore having a severe infection that can result in death of the baby as well as severe illness of the mother. The third condition in which one should abstain from sexual intercourse is if you have vaginal discharge. Unfortunately, yes, it's thought of that If you are pregnant, there's there's little to no risk of you getting PID or pelvic inflammatory disease. But it doesn't change the fact that as a pregnant lady, you are still at risk of getting infections and STIs during pregnancy, herpes, chlamydia, gonorrhea. So basically, in such cases where you have abnormal discharge, I'm not talking about like the normal discharge. Women who are pregnant, because of the immunosuppression that comes with pregnancy, can get recurrent candida infections. And candida infection it's like a yeast infection. It's not infectious or anything. It's nothing to stress about. Women are given cotrimazole creams or antifungal creams to try to clear that infection. And that one is not like sexually transmitted. It just happens because of imbalance of the microflora, especially in the vaginal area. And this is not an STI or anything. So in this case, it's a whitish, curd, cheesy like discharge, and it's not foul smelling. It's just itchy. It's not foul smelling. You can't have burning micturition. That's just candida. But the discharge I'm talking about is the foul smelling, yellow, weird, like abnormally burning discharge that one has to be treated for. So in that case, one has to be abstain from sex. The partner also has to be treated for the infection or vaginal discharge syndrome in women, and in male if they have urethritis or male urethritis syndrome. They also have to go into the hospital to get treated for that. In such cases, wait until the infection clears out. If anything, moving forwards, one should use protection to try to prevent such from happening. Number 4, so basically this one's a bit wishy-washy. This one is just women who have a history of premature or preterm labor are then told to abstain. Basically, restriction of sexual intercourse is advised for the prevention as well as management of preterm labor, especially with women who've had multiple miscarriages, which are unexplained. And this also stands for women who have multiple gestations. If you have triplets, twins, if you're carrying twins, you don't want anything that's going to stimulate or induce labor, because sex induces labor. So you don't want none of that, because especially before your babies are viable, you can go into labor and have premature babies, and prematurity is also one of the highest causes of deaths, especially in babies. Without wasting any time, let's get to number 5, placenta praevia, as well as unexplained bleeding in pregnancy. So let's start with threatened miscarriages, because this happens early in pregnancy. And with a threatened miscarriage, I already mentioned in my other video where I spoke about the different types of miscarriages, that a threatened miscarriage happens when especially early in pregnancy, where there's just bleeding, and when you scan, the baby's there viable, but the cervix is closed. The baby's still fine, but there's just a bit of bleeding, and in that case it's a watch and wait situation. Women are told to rest and also abstain from sex, because you don't want anything that's going to disrupt or try to induce labor in that case. So it's in those cases where you have to when one has to abstain from sexual intercourse. The second reason is placenta praevia. So placenta praevia is a condition where the placenta is inserted basically lower in the uterus, closer to the cervix. And this is a problem because normally what happens is that how it's meant to happen is that there's meant to be the head. Okay, that's the vagina. So basically it's meant to be the baby's head that comes out first, and then the baby, and then the placenta, But then in placenta praevia, because the placenta is by where the head is meant to be, when one starts to dilate or go into labor, they can actually have the placenta come out first or be exposed first, and then this results in like bleeding, like extreme bleeding, like bad, and it's actually it can be fatal, because the woman can bleed to death. It's like painless bleeding during pregnancy. And in such cases, women who are diagnosed with placenta praevia are told to abstain from sexual intercourse, because you don't want nothing knocking on that door, on that cervix, You want nothing messing around with that, because the moment you start dilating, then basically you're gonna bleed, and you will need emergency C-section if you bleed like uncontrollably. So it's in such cases where one has to also, you know, watch out and abstain from sexual intercourse. So thanks for watching. This is the end of the video. I hope you now are knowledgeable because sometimes people know, sometimes people don't know, like sometimes they don't know when to abstain from sexual intercourse, and especially for the men as well. Like, you don't want to be, because sometimes a woman will come back from the hospital telling the man that no, they told us not to have sex, and then men will feel insecure and weird about it, and then it will cause interpersonal relationship problems. So basically, to avoid all of that, I hope also the guys were watching, because it is important that you know which conditions should your partner, you know, have one of these conditions or experience one of these. Then you know at least, and are knowledgeable when it comes to them, that okay, in this case, this is when we have to abstain because of the consequences. So yeah, I hope you enjoyed the video. Also, if you want any references and you want to look out any of the stuff that I use when making this video, just check the description box down below. And yeah, make sure you like, you comment, you subscribe, of course. And yes, I will catch you on my next video. Bye.